Dr. Des Fernandes is a name associated with innovation and skin care. And as a pioneering plastic surgeon and the founder of a beloved South African brand, Environ, which is very, very widely known all over the world, he was the first to explore how controlled skin injury could actually improve the health and the appearance of the skin. And today we are diving deep into the story behind skin needling, how it started, how it works, and where it's going to end up in the future. So, Dr. Des Fernandes, thank you so much for joining me on Aesthetically Speaking today. And you were one of the first to explore what I've just described, that controlled skin injury could actually improve the skin. What sparked this idea in the first place, and how did your background as a plastic surgeon shape those early experiments?
Thanks, Paola. That's a complex question, and it starts off with I had to try and work out, these barcode lines on people's upper lips. I was trying to work out how to fix that. And I was doing needling under the skin, parallel to the skin, but it caused a lot of bruising and also sometimes lumps. It gave good results. I actually presented the results in 1995 in Taipei. And but in 1997, I went to São Paulo to a conference there, and I heard this Canadian plastic surgeon, Andre Camirand, and he was talking about needling scars, making white scars more skin-colored. And he was using a tattoo artist's gun. Now, tattoo artists have been needling scars for a long time. So they call it dry needling. And now I realized that I could apply that technique that he had used onto my patients. So when I returned to South Africa, the patients that had been scheduled to get the horizontal needling, I told them I was going to do something else. And so I needled them with my tattoo gun that I had, because I'd trained many years before. And then I did it once a month in the one patient for 3 months. Then I did a facelift on her, and around about 4 years later, I looked at her upper lip and I saw that it was still perfect. So I knew that that was my definite proof that it wasn't a temporary change in skin, that it was in fact real rejuvenation of the skin.
All right, so those were the early days, and thereafter, were there more patients? What did you start to notice? Were there different types of skins? Would you say that you would needle every single skin type from any age?
Yeah, well, what I sort of found, I extended this treatment to acne scars. I even went on to burn scars and made an incredible difference to people. I remember one particular patient who came, she had her neck fixed to her chest, and we needled her, and she ended up being able to keep her face,
Lift her
face forwards. So everybody who needs needling, I would treat. It doesn't matter your color of your skin. You're not going to get any pigmentation if you do a needling, especially with a roller. So I think that it's use for scarring, for uneven skin color, and for photoaging, that this is the best treatment available, the best and safest treatment in the world.
And what about conditions such as rosacea or acne, cystic acne? Is it still indicated that skin needling would help these conditions?
This is the advantage of going to conferences. When I started, I said, no, I'm not going to do anybody who's got active acne.
Yeah.
And now I've been to conferences where people are presenting their results of needling patients with active acne, and they're getting lovely results. And the acne clears up.
Okay, that's amazing. I mean, that's one of the things that you just think that it would exacerbate the condition, but
Yes.
and rosacea?
No, I would not. I would not needle a patient with rosacea. I think we need to settle the rosacea first.
First.
Yes, and I have a technique to do that. And then after that, then I would needle if it's necessary.
And in terms of anyone new that is listening, Doctor, let's just go into the actual science. What happens when you pierce the skin with the needle? What happens in the skin?
Yeah. The needle pierces the skin and pierces the little blood vessels, the little arterioles and capillaries that we have immediately underneath the skin. As a result of that, blood pours out.
Okay.
Now, the body's got a system built in to stop that. You know, it naturally causes clotting of that
Clotting. Yes.
area. But at the same time, it's releasing special growth factors. And those growth factors are to cause healing. Now, the particular ones that are important for us, I think, are the transforming growth factors. Now, what happens is when you cut the skin, because that's the only way that bleeding occurs naturally, you have
Yes.
to disrupt the skin.
Yes.
And then the skin is exposed to a lot of oxygen. This is what I believe. And so the transforming growth factors present themselves in a different pattern from when you needle, because when you needle, there's no oxygen at all. And I think that's why with needling we get a reversal. We don't get scarring, we get regeneration. And that's the only process described in all of medicine that causes regeneration. So that's what we had to concentrate on.
Yeah.
Is you have the best quality needle. Later on, when I finished the initial research, because you have to try this out first with
Yes.
prototypes before
Yes.
you try the real thing. And that's when we started to use stainless steel needles. Now
Yes.
that's what your surgical instruments are made out of. So that when
Yes.
you operate on people, you don't give them a risk.
Yes.
And also that you keep your needles as sharp as possible.
As possible.
Whereas
Correct.
many of these rollers are designed for one-time use and throw away.
Yeah. Yeah.
And I have another view. I prefer that we have to make the treatments as affordable for people as possible.
Well, that is a very, very good point. Doctor, who gets the best results from needling? Or rather, let me just rephrase that and say, who shouldn't be doing microneedling?
I think everybody who's healthy should do microneedling if they need it. But for example, I had a nurse working with me, and she's got terrible skin damage. She's exactly the opposite of what Environ wants people to look like.
Okay.
And I needled her, and I was shocked by how much she improved. And then I thought, I'd just recently had a blood test, and it turned out I'd had my platelets counted, and I'm in the sort of low spectrum of normal for platelet count. So I checked hers, and she's in the very highest level of platelet counts. So I think that certainly makes a difference
Okay.
because if you've got more platelets, it means you're going to get more growth factors.
Correct. Okay. So then would you say that then before needling you should really have a blood test?
No, I don't think that that's practical at all for people.
No.
You know, it's just an idea. I've spoken to many doctors about it, but it's not something that they, I think the thing about needling is that what I've worked out is you do the needling at a week's interval and you do, say, a minimum of 4, but more likely 6, and you're going to get a good result.
Is that 6 in what space of time?
In 5 weeks.
In 5 weeks. Yeah. So
The
if you're
nice
doing it
thing,
in clinic, it's not really affordable. But if you're doing it at home with the correct roller, it's the way
no,
to go.
no, no. You need to be done by somebody who's a professional. And that's why what we look at is where are the expenses? Okay, so the expenses are the time in the area where you need to do it. Now, because we can do 1 millimeter under local anesthetic, we don't need to be in an operating theater.
Okay.
So we can do it in a clean, sterile room, the sort of side room that most doctors have got. And not only that, but trained skincare therapists can be trained to do it. And this, I believe, is the way that we make it more affordable for people.
In terms of recovery, just take us through what time is needed. What is the downtime? Everybody's so busy nowadays. You say, oh, well, I'm going to go for my skin needling. I understand the skin will bleed, it'll be very red, but it should be fine the next day.
And now the thing is this, that when I show you the photographs of needling with all the blood and so on, that's not what it looks like when you wash off the blood.
Yes,
You look a little bit pink, like you've been in the sun.
in the sun.
But the important thing is this, that one of the things that I realized right early on, the holes when you use a mechanical machine are too close to each other, because this is where you've got to understand that the skin
Okay.
resists being pricked. Now, with a mechanical machine, you can overcome that resistance. And you will put a little hole right next to another one. Whereas with the roller, we're not using the same degree of pressure on the needle. And so the needle slides into the nearest hole. So so you don't get too close a hole, because if you do, you get a lot of swelling. And that's why when people have done mechanical needling and then I tell them, oh, you need to do this once a week, they say, no, they're not, because you look awful for 5 days.
Yeah.
If you use the roller, then you go back to work the next day. And people say, oh, you've been a bit in the sun yesterday. That's about it. And they don't say, what horrible treatment did you do?
Yes.
Something like that. So it becomes something that you can keep private even. And I know many people who do this regularly. And there was one woman who came to see me about needling. And I said to her, do this and do this every week. And she decided to do it twice a year, and then sometimes even more than that. And I was once sitting in a concert, and my friend said to me, you know, do you see that person? Everybody says you have done the facelift of a century on her. And I said, that's very strange, because she's never had a facelift. Oh, my friend said she goes to London and she's probably had one there. So I saw the patient a little bit later and told her this, what people were saying. And she said no, she had never done a facelift. She has done needling now for, I think it
Odd
is
year.
25 years. She does needling regularly. She looks magnificent.
So then this is good news, because I was actually going to ask you, would you say then that needling could sort of delay having to have surgery, like a facelift? Could it even avoid, a future surgery if you look
People,
after your skin like that?
people are very different in the way that they age. Now, in somebody whose skin is the main problem and it's not the tissue sag beneath it,
Yes, yes,
and there are quite a number of people like that.
yeah,
If they did needling, they probably will never want to do any lifting. Some people, they have deeper tissue, and the deeper tissue sags for various reasons. And for them, the proper thing is to do a lift. But the thing is that they can do both. If
they
they
can
want
do both.
real rejuvenation, like you lift up the deeper tissues, and then
Yeah,
you treat the skin primarily with vitamin A and then needling, and you get rejuvenation. It's real. They look much
yes.
younger.
Yes, and let's just go back to skin health and what you mentioned now, needling with vitamin A, and tell us what a game changer it is if you needle with certain ingredients like vitamin A, like the C vitamin and advanced peptides, say.
This was a great thing about the research that we did at Hanover University. They checked what happens if you just use vitamin A and C and E on the
Yes.
skin, and then they checked another group where they used vitamin A and C and did 4 needlings. And then they did another group where they didn't use anything and they did 4 needlings. So with the people using just the skincare alone, they were able to show that you significantly increased the amount of collagen, the thickness of the skin.
Yes.
But when you did needling with the skincare that I've described, plus 4 needlings in 3 weeks, then we almost quadrupled the results. The thickening
That's
of the
amazing.
skin was amazing. The thickening of the collagen was tremendous. So now what I believe is that while ACE, and you need the vitamin A because it primes up the fibroblasts to make collagen, and then you need the vitamin C because collagen needs vitamin C to be made. And then you do the needling, and you've got the factories all properly primed. But I think that we get even better results when we then add something a peptide that promotes even more collagen and elastin. So that's why I think the role of peptides plus needling is very important. And then, of course, vitamin A is a great stimulator of hyaluronic acid. It's the strongest natural stimulator of hyaluronic acid. And so hyaluronic acid, I don't believe, is an important part of the skincare because the ingredients that are in the skincare are promoting the hyaluronic acid. A lot of people are using hyaluronic acid as the treatment for skin that has
Yes.
been needled. And I
Yeah.
think they're missing it. I think the proper one is to use the vitamin A. The vitamin A is going to stimulate the hyaluronic acid by itself.
Well, isn't that what Environ's all about? Always science over the trends, and hyaluronic acid has been a trendy ingredient, like vitamin C. Um, how does the philosophy of science above all guide you today? Writing in the aesthetic medical industry, for me, is incredibly overwhelming how there's so many innovations. Every year we get, I mean, last year it was biostimulators, it was polynucleotides. This year it's just been about exosomes, about, the growth factors. And how does your philosophy guide you? And what do you think of all these innovations today? Are they exciting for you? What is your stance?
Well, I look at what is the physiology of the skin, because that, after all, is what is going to determine what happens. Have we got the enzymes to deal with certain chemicals? Have we got the cofactors? Maybe even, do we have to change the micronutrients of skin for certain things to work better? And so that's why I'm driven, first of all, by what is naturally used in the skin. Because we know that when we look at beautiful young skin, that was made by nature.
Yes.
So nature has an ability to do a lot. We have to understand what was the damage that skin survived to make it look like it does.
Yes.
And so from my point of view, if something, doesn't actually fit in with the physiology, then it's probably not going to be useful. Now, there's lots of things still to discover about the physiology of skin. So that's why it's an exciting field still. Now, one of the big things you mentioned was exosomes. Now, from my point of view, I think, well, most people don't understand that exosomes are made naturally in every cell.
Yes.
Every cell makes exosomes. And if you've got unhealthy skin, you're not making healthy exosomes. If you've got healthy skin, you're making healthy exosomes. Now, why should I get some exosome from a plant, an animal, or something else to make the skin behave even better, healthily, when we in fact know that if we make healthy skin, we make healthy exosomes that are then spreading the messages to the surrounding cells to do what is needed to keep skin healthy. So I'm not a great fan
Okay.
of exosomes. I think also most people don't understand it can't be absorbed through skin, and there are disreputable companies that supply skincare creams with exosomes.
Well,
And
it's everywhere now. It is everywhere. Well, Doctor, you're as controversial as ever. That'll spark a debate. I look forward to that. But I think we'll have to wrap up now. It's just incredible how that idea that you had in the 90s, that skin can regenerate this itself with the right type of needling. And it's actually become a cornerstone of medical aesthetics and skincare. Thank you so much for sharing your knowledge and your insight with us on Aesthetically Speaking. I do look forward to another conversation with you soon.
thank you very much, Paola.
I'm going to
Thank you.
rush off and do my needling.
Well, I did my cosmetic needling this morning.
Oh, shush. I'm jealous.